Hi guys, now that we are done with fluid resuscitation in pediatrics, so let's get back to our psychiatry. So yesterday we did briefly talk about the signs and symptoms that makes us to say that a patient has got a psychotic disorder, and I'm gonna write them again. But now what I want us to talk about now is the specific conditions under the psychotic disorders. So we're gonna be talking about a brief psychotic disorder. And remember, I'm gonna say this again. When you are studying psychiatry, try to have an approach. So study the symptoms under a specific umbrella, like psychotic disorders, like mood disorders, like anxiety, and so forth. So study the symptoms that you expect under, because the conditions that are listed under psychotic disorders, their symptoms are very, very similar. So, and the difference will be just now be the duration and the other things that are add-ons. The same thing applies with the mood. Study mood symptoms, study anxiety symptoms and know them, and then later on decide, try to figure out, now that I've got these symptoms, what is my actual diagnosis? Because I'm gonna show you what I'm talking about right now. I have been trying to explain this, and I keep explaining it because I think it's so important. So, like we said, that patients that have got so the conditions that are under the psychotic disorders, they share these symptoms. They share delusions, they share hallucinations, they share disorganized speech, disorganized behavior, and including catatonia. They share, what else do they share? Delusions, hallucinations, disorganized speech, behavior. I'm not sure if there's a fifth one, but basically okay, no, there are four. So these patients, they share these symptoms. Now what is left of us is to decide, does this patient have, so these symptoms are found in all patients that have got in all patients that have got psychotic disorders, but the combination will vary, obviously, like I said yesterday. So this umbrella that we are dealing with, we know that because of these symptoms, it's psychotic disorders. But now we want to talk about brief psychotic disorders. So according to the definition, for us to say, according to criterion A says that in order for us to say someone has got a brief psychotic disorder, they must have one or more of these symptoms. Get that, guys? Criterion A says if you are to diagnose brief psychotic disorder on a patient, that patient must have one or more of these symptoms. One or more of these symptoms. And these symptoms must be, and one of these symptoms must either be 1 or 2 or 3. So I'm gonna repeat it again. It says, for criterion A, for you to diagnose brief psychotic disorder, that patient must have portrayed one or more of these symptoms. And one of those symptoms must either be one, so it must either be a delusion or hallucination or disorganized speech. That's what it says. So which means that when a patient has got a delusion, that's enough to diagnose. Yes, we are going to talk about other things, but I'm just talking about criterion A. So according to criterion A, if you have a delusion or you have a hallucination or you have disorganized speech, then you meet criterion A already. So you can have one or more of these symptoms. Let's say you've got 3 symptoms, but one of those 3 symptoms must either be a delusion or a hallucination or disorganized speech. But if you only have one symptom, then it means that one symptom must be a delusion or a hallucination or a disorganized speech. So which means you can have this and this, or you can have this and this, or you can have this and that. That's criterion A. Criterion B says that those symptoms must have been there for more than a day to just a month. And after that month, this patient must be symptom-free. This patient must be symptom-free and they must return to their functional level which they had before the symptoms began. So they must be fully functional if they were fully functional. That's criterion B. Criterion C of diagnosing a brief psychotic disorder says that these symptoms must not be explained, or they must not be better explained by a depressive disorder with psychotic features. Or it must not, so these symptoms must not be due to a depressive disorder with psychotic features. They must also not be due to a bipolar mood disorder with psychotic features. This is how now you diagnose a brief psychotic disorder. And these symptoms must also not be due to substance or some kind of medication. Again, these symptoms must not be due to another medical condition. Right? So, this is how you diagnose a brief psychotic disorders. Now, let's talk about specifiers. So, specifiers, I'm not sure if as students in other universities you are required to know specifiers, but in UP we were required to know specifiers, and they were not so easy to remember. But in any case, a specifier is something that if it's there, you must specify and say it is there. Like for instance, there's a specifier for this. You need to specify that if this patient has got these symptoms, but they have recently been stressed, psychological stress, in them, for instance, if they've lost a loved one, or if they have had a psychological trauma in a way. Maybe they have experienced someone die, or they've lost their loved one, or they've seen an accident unfold, or they've seen some kind of maybe someone killing another person, or a natural disaster, or someone drowning, and then they get psychotic because of that. So you need to specify that with a recent stressor. There are different ways in which they write it. So that condition is called a brief reactive psychosis. Brief reactive psychosis. So basically, you have a brief psychotic disorder because of your psychological trauma, because you have experienced or you have seen something, you get psychotic because of that. So that's called a brief reactive psychosis. So you need to specify if there's a stressor, if there was a stressor, or if there was no stressor. Those are the specifiers. The last specifier is to mention if the patient is postpartum. They say it must be within 4 weeks of delivery if it's postpartum. Postpartum most of the times means 6 weeks in other things, but here they say 4 weeks. I don't know why, but yeah. So guys, this is brief psychotic disorder. So I will briefly explain it again. What I'm saying, guys, is that all psychotic disorders, they share these symptoms. They don't have to have all of them. They don't have to have all of them for them to say, for us to say that it's a psychotic disorder. So they share these symptoms. Now, with a brief psychotic disorder, in order for us to say that this is a brief psychotic disorder, we look at the criteria, criterion A, criterion B, criterion C, and also look at the specifiers. So criterion A says that in order for you to think about a brief psychotic disorder, you must have one or more symptoms, one or more of these symptoms, and one symptom from the symptoms that you have must either be a delusion or a hallucination or disorganized speech, like I've written here. And criterion B says that the symptoms must have been there for more than a day, but less than a month. And this person, after a month, they must be symptom-free and return to their functional level which they had before the condition. As we know that the minute the symptoms go past 1 month, it's no longer brief psychotic disorder. As we are going to talk about it, it becomes now schizophreniform. Criterion C states that these symptoms must not be due to a depressive disorder with psychotic features. They must not be due to a bipolar mood disorder with psychotic features. They must not be due to a substance. They must not be due to medication. They must not be due to another medical condition. And you must specify if there is a history, there are stressors, recent stressors that would have pushed the patient into a brief psychotic disorder. And if there are stressors, recent stressors that are causing the symptoms, then that condition is called a brief reactive psychosis. And then you must also say if there were no stressors. And also specify if these symptoms are postpartum. So postpartum brief psychotic disorder. Thank you so much, guys. We are going to talk about schizophrenic form. The reason why I'm starting with a brief psychotic disorder, we are going up like this. We are doing 1 day to 1 month. The next one is going to be just over 1 month to less than 6 months. The other one will be more than 6 months. So we are going like that. Okay, guys, thank you so much.